know headache kills faster than poverty? Hi guys, Dr. May here. I'm super excited to be here with you. Welcome to my channel where we talk about health tips for healthy living. However, today is World Hypertension Day and we are going to be talking about hypertension and high blood pressure. What is high blood pressure? This is when the blood pressure or the force in your blood pushing against the blood vessels is constantly high. High blood pressure is also known as hypertension. Now, this can happen at any time. Do you know even people of young age can have hypertension? What are the common symptoms nowadays? Headache is first a simple symptom of hypertension. There are individuals living with 2 months history of headache. Some people take paracetamol day in, day out, and even feel that if they take in alcohol, it's going to reduce the headache. Oh no, I think you should get that headache checked out. Even insomnia. So inability to sleep most times is not just because you don't feel like sleeping, or because you've not eaten, or because you are feeling hungry, or because your village people are following you. Most of the time is a simple sign of hypertension. Chest pain, palpitations, tiredness, weakness, blurry vision. These also should all be checked out. Who are the people at risk of hypertension? Do you know someone with a family history of hypertension? That means a young man or a young lady whose mother or father or grandparents has had hypertension before are at risk of having hypertension again. Now, you must constantly check your blood pressure. Age. The older you get, the more likely it is for you to have high blood pressure. This is because as we grow older, some of our blood vessels already lose their elastic quality. However, some children also have high blood pressure. Gender. Before the age of 64, men are at risk of high blood pressure more than the women. After the age of 64, women are at risk of high blood pressure more than the men. Now, there are some modifiable risk factors, and these are things like high intake of alcohol consumption, obesity, not getting enough physical activity, those that always sit down without doing anything, those that smoke, those with high cholesterol are at risk of hypertension more than others. How can you prevent and manage hypertension even when you have some non-modifiable risk factors? You cannot afford to be seated all the while. What I'm saying is you can't afford to lazy around. First things first is move your body. You have to exercise. You have to avoid sitting down for 24/7. You must do something to move your body. You must reduce obesity. We have to reduce salt intake. In our proper food diet, we have to get a proper food diet which has reduced salt intake and more of vegetables, more of lean meat, and less of calories. We have to limit alcohol intake. Sincerely, I'm not here to break the table of those that drink alcohol, but taking too much of alcohol isn't going to take us anywhere. Then those that smoke, I'm going to break your table. You don't need cigarette at all. Stop smoking. And also visit your doctor as soon as possible. This is it. If you have hypertension, you can manage it. Take in your drugs, have good diet, eat healthy, also exercise, avoid stress. What can hypertension do for you? Hypertension is prone to causing various heart diseases such as stroke, hypertensive heart failure. Hope you enjoyed this video. Please do well to like, comment below, share with your friends and family, and subscribe. See you in my next video. Bye. Gender. Usually in men is more please hit the streets. You don't use the street to cancel. Glory to God. Jesus, inside my video. Subscribe, share with your friends and family, and subscribe.